dedicated to empowering you with information
to make positive choices
and be advocates for your overall well-being.
Welcome to The Health View. Welcome to The Health View. I'm Yvonne Dunitz, and with me are Dr. Margarita Ochomaya and Dr. Laura Chan. We're so excited that you're with us today because today we're going to be talking about the important role of cholesterol and what it does to your body and how it affects you and your health and well-being. So the most important question that I'd like to lead with, Dr. Margarita, is what is cholesterol? What does it look like in the human body and how on earth is it made?
So cholesterol comes from a fat. And so when we usually think of the word cholesterol, we think of the fats that are in our body. And it's usually made by, number one, what we have in our diet and what is then produced in the liver. And so we have two types of cholesterol. We have one that comes from our food, and we have others that have been collected and distributed through the body and then brought back to the liver. And then we kind of have a circulatory system. They circulate in our body and are very important for the structure of cell membranes and the function of your brain and your neurons. But sometimes cholesterol can go a little bit off. And so it's a very important tool for doctors to evaluate.
It's an interesting thing you said related to cholesterol with food. Dr. Laura, what types of food would actually bring cholesterol into our bodies?
Right, so that's a good question. So most people think of eggs as a food that's high in cholesterol. And so previously it was advised to avoid eggs because we were concerned about cholesterol being too high. But not all cholesterol is absorbed. There's only a certain percentage of cholesterol that's absorbed from foods that contain cholesterol. So that's important to remember. I think it's about 80% of cholesterol is produced in our body, and 20% of cholesterol is from food that we eat.
So other types of foods besides eggs might be cheese,
eggs,
right?
Yeah, cheese, meats, that kind of, most animal products contain cholesterol.
Most animal products. So is cholesterol good for our health?
So that's a good point, because as we're thinking of the cholesterol that could come in the food, we have good cholesterol and bad cholesterol, or what we would say good fats and bad fats. And so saturated fats that would come from animal fats would usually be sometimes more prone to have problems and cause some toxicity in the body, whereas, for example, cholesterol in fish oil or the cholesterol in good seeded nuts like almonds, those kind of fats would be good. Would you agree?
I would agree. And I think the research is starting to shift a little bit regarding saturated fat. We'll talk about that a little bit. I want to add to something that Dr. Margarita was mentioning with cholesterol, that it also is a precursor to certain hormones in the body. And so a lot of people think of cholesterol as a bad thing, but it's not. It's really essential for life. And it's essential for the production of steroid hormones that we need, and like Dr. Margarita said, for the structure of cells.
But what about this whole thing? People are so aware of their cholesterol numbers. What do the numbers really mean?
I think it started pretty much when we started investigating heart disease. And when we started looking into heart disease, we identified that some causes of heart attacks could be a cholesterol plaque. And so when we look at what does that mean, is that there's been a very large awareness campaign throughout the past 20 years to address these fats in our body and in some way use them as a sole culprit for a heart attack, when I think as we think the more contemporary medicine information coming out is not just cholesterol, there's a lot of other factors. But what it means to people and how they might be relating to cholesterol would be sometimes looked in a negative tone, and if you have high cholesterol, you're going to have high risk of a heart attack or a stroke or cardiovascular disease in general. So what we want to think of is trying to understand really what it does so that we can then later decide, what is the good and the bad. And I know we're going to discuss this today.
Absolutely. So related to, if we were to have a glass tube and cholesterol was in it, what would it look like and what would it do to the human body related to the function of the body and
Yep.
how it could affect us?
So cholesterol looks like a waxy substance. Almost if you were to take the wax from a candlestick, it's fatty. It wouldn't. You'd rub it. You'd feel it on your fingers. It has a
Feel like a
density
little
of
gritty or
fattiness
something, yeah.
to it. And so I liked your glass tube because I'm going to switch to thinking of that as a blood vessel.
Exactly.
So,
That's what I was hoping you'd
no,
do.
I'm glad. So we have two major types of cholesterol. We call them the good and the bad cholesterol, which is a little bit simplified, but it's helpful for understanding them. And the good cholesterol we call HDL, and we were laughing about our ways of remembering that. I think of it as H for healthy, and then we have the LDL as L for lousy, and you said L for
Happy.
H for happy. That's what it was.
We were both right.
You were right there.
So we have those two types of cholesterol. Now, LDL comes through the arteries, and I like to think of it as almost like a dump truck. That's the analogy I use. It comes through the arteries, and it drops off the cholesterol, the fats in the cells.
Okay.
Now, why does it do that? This is a big question. Why does it do that? And one thing that we're starting to understand is that it's actually helpful for repairing the lining of blood vessels. When there's inflammation in the blood vessels, LDL cholesterol is helpful in coming and repairing the lining. So LDL cholesterol is very often at the scene of the crime when there's a heart attack, so to speak. It's very present. But I think we've confused that to always thinking that it's the perpetrator in the crime, it's the problem. And there's an extent to which it can be, but I think it got overlooked that it's often the inflammation underneath it that's the bigger problem and the reason that it's there and is building up. So LDL comes and is dropped off like a dump truck dropping it off. And then HDL, the healthy one, is like a snowplow coming through and cleaning it off and bringing it back to the liver. So we want more HDL to come and clean it off and move it out of the blood vessel.
It was
It's a
interesting.
wonderful explanation.
It really was,
Thank
and I
you.
got this visual like you're bringing the soil to your garden, and you have this huge pile, and you've dumped it some, and so you're filling a component.
Yep.
And now you need to smooth the path to get everything to flow nice and easy,
Yep.
so that things
Be
will be
good.
nourished and nurtured in the right way, which is
Exactly.
fascinating to say this. So, the real cause of heart disease is what then?
Well, I'd like to talk a little bit about more in terms of the inflammation.
Please.
Which was the segue to what
Yeah.
you were saying. So what ends up happening is the inner lining of the blood vessels, they have a little bit of a membrane, and that membrane or that lining is called the endothelium. And this membrane has these opportunities to get cut, like a smear or a cut or some things that when that cholesterol gets deposited, there might be some sources of like turbulence, like white blood cells can even come and try to defend, and there just becomes an event, like when you're driving and there's a big hole on the road. There's some that you drive over and then, you hear the bump, and some like you could really damage
Real
your car.
pothole where you can
Right.
get really stuck.
And so this endothelium starts trying to fix itself, like we discussed, and that's part of why the cholesterol might even be there. But then it brings out a clot. It might bring out some things in the blood that create like more patches and more patches. And these patches grow, and then they become unstable, and there's still a lot of action going on, and a little piece could break off. And as the blood vessel, it's going to get thinner and smaller as we get deeper into our periphery or into a coronary artery or deeper into the brain. It can enlarge and then create a no passing of blood. And if blood cannot pass, no oxygen is delivered, and the
Exactly.
tissue after the block dies because of lack of oxygen and delivery.
So the symptoms in the body as a result of that would be what?
Well, that would be a heart attack or a stroke, typically.
And what other signs would come up for people in the early stages of how cholesterol may be impacting their bodies? What types of symptoms might they have?
Okay, so in some instances, we could have physical signs. So you can see sometimes people accumulate cholesterol patches under their eyes.
What would it look like?
Like yellow plaques or white plaques under
Literally
the eye.
scaliness
Yep.
under
Like
their eyes.
you can
see it.
like papules, like a little bit of white rims. You can also get a rim around your iris that looks a little gray.
Really?
With cholesterol deposits, but that's a little long term. Short term, you could have high blood pressure. And that, why would that be? Thinking of a plumbing situation, if there's been a little bit of accumulation in the periphery of the blood vessel, then where it's flowing, it's a little bit more tense, creating high blood pressure. So in a way, cholesterol can lead into high blood pressure and things like that. But I think ultimately that could be a silent problem brewing in the person.
It's often a silent problem, I
Yes.
think.
So
they
what
might
other
not know.
problems might come up that might be, if that's brewing, would there be certain things that may become apparent that they need to be aware of to go to a doctor for? Might they be sluggish or get more tired, or what might
Not
show?
necessarily.
What could it
And
be?
So that's
Silent
why
killer.
it's a silent. So that's why cholesterol gets screened for in most physicals.
And the
most,
type of screening that should take place would be
it's a
what?
blood test.
It's a blood test.
And the person needs to be fasting, meaning they shouldn't have eaten for 12 hours prior to the test. So most people will go first thing in the morning and have their blood drawn.
Now, is that test really accurate?
That's a great point. So in investigative laboratory research, every day something is new. And a regular screening test does not need to be the most in-depth of all tests. But we do have access to very extensive analysis of cholesterol. But the basic screening test should include a total cholesterol, which is pretty much the total collection of all the particles that we would be measuring. I don't always think of that as a very important number, whereas when it's high, it is obviously important to realize, well, it's carrying a lot of mini particles underneath it that
And
we
that's
need to
the
measure.
LDL that you were speaking
Exactly.
of, the dump truck.
The LDL, the HDL, and then we have to mention one more, which is the triglycerides. Triglycerides are not always discussed, but they're also a marker of how you're eating. So if a person is having a lot of carbohydrates and a lot of fats in their diets, triglycerides would be a little higher. It is also high when a person is diabetic.
Now let's talk
And you
about
can see
carbohydrates.
it. You can see it when you draw someone's blood,
Right.
and someone's triglycerides are high.
What do you see?
You can see a white waxiness almost in the tube.
In the
that draws
tube, you
blood.
can see it that quickly.
Yep,
Really?
you can
So
see
just
it.
for the listening
Yep.
and the viewing audience, again, for carbohydrates, what would be the types of carbohydrates that would contribute, just as examples?
For cholesterol?
Yes.
Matt? Yeah, I think the concept is not necessarily the carbohydrate itself, but it's a carbohydrate and a fat. And we usually eat a mixed meal. So,
Correct.
for example, if you have a pizza,
Yeah.
the carbohydrate was the dough,
Right.
but the cheese, the fat that is on it. So sometimes we can create a power molecule by adding a carbohydrate and a fat. So that's kind of where I'm thinking there.
So one way, if I may, that I like to explain it is the word triglyceride. The glycerin part is the sugar molecule, and a triglyceride, there are three of them. And so it's a type of fat that's made from sugar. And so sugary foods, candy, cupcakes, cookies, that kind of stuff, and then foods that turn into sugar, like
And it has
pastas
the
and breads.
it has like the glyceride and the glucose.
Yep.
Right.
So those
Great
are going to
point.
raise your triglycerides. And from some of the research that I've seen recently, it's actually the triglyceride to HDL ratio that's the more predictive marker for heart disease than total cholesterol, like you were saying.
Absolutely.
So we need to see those triglycerides, and we need to see the HDL, which again is like the snowplow that comes through and clears the artery.
So what types of treatments would there be for somebody with high cholesterol?
Well, I'm really partial to diet and lifestyle. Certainly statins are most well known, and while they have their time and place, they also have some side effects.
And there have been some research coming
Yeah.
out and some precautions related to statins.
Absolutely.
Yeah.
What might those precautions be for people? I know we'll get right back to you, but it'd be good to jump right in there.
Super important that, number one, generating an awareness, and that's what we're trying to do here in our show, is to help people say, well, you know, maybe do you know your numbers? Do you know what's going on? Should you ask that to your doctor? What's my cholesterol level? Secondly, in terms of treatment, the majority of times we always start with lifestyle. And again, we will both be very synchronized in our opinion there, because a good diet, a good fiber in your diet, exercise. And then when we talk about medications, what happens is that if you are put on a statin medication and maybe it's too soon, or if your system doesn't metabolize that drug very well, a side effect could be significant muscle aches and generalized pain. And it happens to be that it's a byproduct of the cholesterol medication can actually accumulate in the muscles and create inflammation. And
Yeah,
so,
besides inflammation, has there been anything related to perhaps some memory loss also with statins?
Yes, poor memory issues, which is important to remember. One of the functions of cholesterol is that it's actually in our brain. And so when we don't have enough cholesterol, it can affect memory, and sometimes it can affect mood. If you see someone with very, very low cholesterol, they might tend more towards depression and things like that.
yes, absolutely. And very important, myelin, which is the means by which within a nerve, a idea or an impulse can communicate throughout those nerves. The myelin sheaths, which are these little cholesterol clusters covering that nerve to protect it, also serves as an insulation to make that speed of that thought much faster. So not only would it be potentially dementia, but it could also be just a particular brain fog.
So the role of fat.
Yes.
Fat and treatment and everything. I know this is a part that you're very passionate
I
about.
am.
So let's talk about fat.
Because
how does fat play
in
all
the
of this?
90s, that was the big push for heart health was
Right.
minimize fats, eat a fat-free diet, low-fat diet. And we had the food pyramid, and it was grains on the bottom, and fat was the little pyramid part on the top, and it was eat as little of that as possible. That was the main recommendation for heart health. And we saw, in fact, that that was not helpful. That was not reducing the risk of heart attacks one bit. And so we've learned a lot from this. And I feel for people who had to cut fat out based on the dietary recommendation, because it can be so delicious and such a enjoyable part of our culinary experience.
So good fats are?
So good fats are olive oil is a big one. We want to talk about the omega-3 fats are really important fats, and olive oil is a big one of those. Nuts, walnuts, for instance, are another good source of omega-3 fats. And just to explain here, so omega-3 fats are a type of unsaturated fat, which means it's liquid at room temperature. Saturated fats are solid at room temperature. Butter, coconut oil, cheese, that kind of stuff. So going to the unsaturated fats are considered the healthier type of fats. But even amongst those, we have one called omega-3s. A lot of people have heard about those, and omega-6s. And what's really important is that we have a good balance between these two.
And how does one get a good balance?
So most people are getting too many omega-6s in their diet. That's from vegetable oil. So French fries, for instance, are fried in vegetable oil.
Okay.
What we want is more omega-3s, and that's in olive oil, in nuts, like walnuts are a big one, flaxseed are a good source of that. And so we want to tip the scales this way, and that really helps control the inflammation that the cholesterol is coming through the blood cells and is trying to protect. So it's really managing inflammation through healthy fats that makes a big difference.
And what's the role of fish oil? Does that play a part in it all?
So that would be part of like
That'd be a really good omega-3. Yep.
Really good omega-3.
Yes. And I the way I describe it too, and to try to help our viewers, is that a fat goes with a fat. Like when we've all done the third grade experiment of the difference between fat and water and how they just cannot really blend. When we are even trying to eliminate our cholesterol, the way to eliminate that would be through another vehicle, such as an omega-3, to then allow the gallbladder and everything else to then come back out through the gut and the liver eliminate. And you mentioned it so well. The liver is the number one producer of cholesterol, as much as we think it's the diet, but the liver is sometimes being overtly protective and sending out these messengers to heal the inflammation. So if I could backtrack, the real treatment for high cholesterol is taking care of inflammation.
Taking care of inflammation. So the best care of inflammation that we can do for ourselves is what?
I'll start with the gut. We are what we eat, and definitely when we start eating a healthier diet, maybe most importantly, putting in the environment first. And so when I say the environment first is if you have a lot of products that would have pesticides, herbicides, and situations of this nature that would burn the inside of our gut, creating, like if you have ever seen eczema in our skin, well, eczema inside our gut.
So you're saying by inhaling, being in an environment,
eating foods that have
thank you.
Exactly.
You want to clarify
that, right? And so by eating healthier foods
that don't have pesticides,
so
washing them
herbicides,
well or cleaning them off.
Yes, and we're getting
Or make it
organic, and we
organic.
did talk about the clean and
The clean 15 and the dirty dozen.
Right.
Yep.
And so, but then furthermore, more looking at how the good bugs, the bad bugs, and trying to keep everything in balance. But I think if you went more to a local farm and you were eating healthier, more local, environmentally healthy foods, that would be very good for you.
And I would add to that
Please.
fats. They can be a wonderful way to control
What are good
inflammation. Good fats, again, the
Good
omega-3s.
Okay.
That's what we're going for. We
Now,
want
with
to increase the
omega-3s,
omega-3s.
just so they know, how can they eat those omega-3s?
Olive oil
Olive
is one
oil.
of my favorites. Wild fish,
Wild
fish
fish.
oil, or just
Any
eating wild
particular, like
salmon.
salmon?
Salmon's a great one. It has to be wild. It's much healthier than
Versus
farmed
farm
salmon.
raised.
Yep, and that goes for meats like beef. Grass-fed beef actually has much more omega-3s in it than a grain-fed beef. So the devil's in the details here when it comes to diet in that regard. So
And is there a difference between grass-fed and organic?
if it's organic, no. Well, it's not always grass-fed if it's organic.
That's right.
Yeah, but if it is grass-fed, well, I don't know. Those don't always overlap.
So you're supposed to look, if you want,
You
the
gotta
best would
read.
be organic grass-fed?
That would be optimal.
That would be
optimal.
But it's
But,
important. It can be
yeah,
confusing because
it
we're
can
all
be
kind of
confusing.
The labels,
the
you know?
labels
Yeah.
are unbelievable.
But if someone does eat animal protein, choosing grass-fed, choosing organic is going to be really helpful because you get more of the omega-3s in that, and that really helps reduce inflammation in the body.
Let me ask you something. What's the role of dark chocolate?
Ooh, dark chocolate. Dark chocolate is wonderful and very medicinal. And
I like it.
It is very
consider
medicinal, is it?
I
So
consider
100% cacao.
It has
It
to
has
be
to be
above
100%.
70. It has to be at least above 70%.
So that makes it a little
Thank you.
bitter.
I just go right
Yeah.
to the top.
And is there a difference between them?
So, what do you mean, the types of chocolate?
Between, dark chocolate, 75% and up. In other words, milk chocolate doesn't do the trick.
No,
here.
milk chocolate doesn't do the trick.
dark chocolate actually
Yeah.
can be a healing thing for us.
It's
And
because
it could
it's such
help
a
those-
strong antioxidant.
So it can help
Yeah.
the smoothness in that artery go fine, or in that tube that we talked about.
Yeah, it helps prevent that LDL from becoming what's called oxidized, and that's when it's more toxic. So it's a strong antioxidant, and it does help with that whole process.
So how much? How much does one eat to stay balanced?
Of dark chocolate?
Not just
Oh.
dark chocolate, but dark chocolate, the fish, the other types of foods in any given day.
I'd
Is
like
it
to
as-
think of it as
Yeah.
when you have your plate,
Yes.
30% has to be protein,
Okay.
40% carbohydrates,
Yeah.
and then the rest could be in the good fats.
But can we clarify what kind of carbohydrates?
Exactly.
Please,
Yeah.
I
I
want
was
you to
going
do
to
that.
say.
It's important.
So the carbohydrates usually are high fiber carbohydrates,
Like?
which would, like for example, beans, lentils,
Vegetables.
vegetables.
Yeah.
But I always start
Any
even with a
particular
higher.
types that are better?
The high fiber ones.
So give examples to our audience.
So high fiber would be the leafy greens,
Yeah.
something like
Like
that.
the kale,
versus
and the lettuce,
celery,
dark
broccoli,
leaves,
cauliflower,
okay.
versus a really starchy vegetable like,
Like potato? Okay.
squashes, which have great value. But if that's all you're eating, then you're not getting quite as much fiber.
And a roll
with
of
it.
sweet potato versus a regular potato, where does that fall in?
Sweet potato tends to be a little bit denser in certain nutrients than regular potato, so
Okay.
I consider it a little bit healthier.
Okay.
I'd like to
Go
say
ahead.
something kind of important here where we're talking about cholesterol. So
Sure.
I think it's very important to, number one, have an awareness.
Mm-hmm.
And number two, realize that in people who have a heart attack, if we're looking at it, cholesterol to prevent a heart attack
Yes.
or an event, they don't always need to have high cholesterol. They could have a problem where their blood clots and then creates that blockage of flow and then have the event. So we have to also be very careful of the components in our blood. And is the blood very sticky? And is the blood, not flowing well? So I think that as much as it's really important to generate awareness for cholesterol, keeping it in balance, your weight, your health, the way you're eating, and making sure that you check regularly with your doctor.
And how often should one get a blood test to determine their cholesterol level?
Usually someone does it yearly. That's pretty standard.
And would they be feeling anything in between the year related to how they're feeling that might make a difference, that they might need to have a recheck as far as what might be going on within their bodies?
What I usually do is it depends on the initial evaluation. It will be determined as if you're going to be having to repeat it in 3 months, 6 months, or in a year. But if you were in the yearly routine and you suddenly gain 10, 15 pounds, it's very important to realize, well, what happened here? maybe I should have it checked. Not just my cholesterol, but what happened with my body.
Or another perspective on that is because, both of us, but I know I do a lot of dietary counseling with my patients. And so I've had people check back in with their doctor, say, this is going to really shift your cholesterol levels when we change your diet like this. So check back in with them sooner to make sure that, because they've been on statin medication and their cholesterol got too low because we changed their diet, and so their cholesterol naturally went down. And so their doctor was able to take them off the statin medication, and they were able to just have a new diet.
Interesting point, just to summarize that. Can cholesterol being too low cause anything that could be harmful to the body?
Yes.
Okay,
Yes.
what could that be? Just as a quick round.
You don't have good hormone balance, low vitamin D. It can cause poor cognition or a depression, are things that I think of.
There's good studies in the medical literature that say that low cholesterol is actually associated with very high mortality.
Very high mortality. Very, very interesting. Yet we've always been focused, it seems, that watching for high cholesterol,
Right.
that is a critical component that you should be watching for, but you're saying you really need to watch for both.
Yes.
Both.
Fascinating. This has been really, really interesting. Anything else you'd like our viewers to know as a quick summary and roundup? Or have we covered
We're
all?
dressed in red.
We are red.
Go red for women.
Right? And to keep ourselves healthy and make sure that there's heart awareness and to know what we need to do to keep healthy and well, eat properly, and do the best we can to have a healthy lifestyle. If you have any questions at all, please don't hesitate to contact us at info@ycdholistichealing.com. We want to know your questions. We want to know if there are specific topics that you're interested in that you would like us to address. Most importantly, we wish that you take excellent care of you and your loved ones. Make sure that you eat well, sleep well, drink plenty of water, and get outside and enjoy the beautiful changes of the season. We wish you all a wonderful, wonderful week, and we look forward to seeing you next week. In the meantime, be good, take care, breathe, live, love, laugh, be present, and have the best of health that you can have.
The preceding program